I'm Dr. Price Corr. I'm with Albany Surgical, and I'd like to tell you a little bit about varicose veins. What can you do to prevent varicose veins? Actually, probably very little. But if your mom had bad varicose veins or your dad had bad varicose veins, then you have that genetic chance of getting varicose veins just like they did. Smoking probably plays a little bit of a role in that. Birth control pills, well, you got to weigh the positives and the negatives of whether you want to get pregnant. But pregnancy plays a role in it too, because that's a hormonal influence as well as pressure of a baby growing inside you if you're a female. As far as men, what can you do? Well, weight gain, obesity plays a part in it because that puts extra pressure on your legs and on the blood flow coming back from your legs to your heart. So there are a few things you can do, but unfortunately the main reason people get varicose veins is because they inherited a venous issue that they can't really change. So varicose vein treatments varies from whether it's a spider vein, a little small spider web type picture, or whether it's a large vein. Now let's talk a little bit about how do you treat a spider vein. Well, spider veins can be treated in our office, in our practice, a couple of different ways. Number one, you can inject it with a chemical that causes the inside of the vein to be irritated and close down. That's called chemical ablation or chemical closure of that vein. You can also use the vein wave procedure, which is a microwave technology where a little small needle heats up just like a microwave heats up, and you use it for really small spider veins to close them off. And it works very well for veins around the face particularly, and for a little what we call matting of veins, matting, M-A-T-T-I-N-G, where you have this little blush of veins on the leg. And the vein wave works well for that. And then as veins get larger, there's a closure technique that is done with radio frequency. Again, that's heat, or that's what we call thermocoagulation or thermal ablation, which means heat being put on the vein to cause the vein to scar down and close. And that's done very safely in our office. It's done very comfortably in our office. I actually have had that done myself on my right leg, and it went well, and I'm a pretty big wimp. I'm a big guy, but I'm also a big wimp with all that. And it's an easy procedure to do. We have the patient up and walking and back at work in a few days, depending on what type of work they do.